I think we are ready to go. I think we're live. Guys, today's session, we're going to be talking about if you've had a herniated disc or you've had sciatica, excuse that little blip there, and you've been going to physio, you've been going to your appointments, you've been doing it for months or even longer, and you've been finding it's not working. We want to say that it's not that you're broken and you can't get better, but it's that the strategy is probably wrong. And there's one thing that I get all the time in the comments on social media, and that is, yeah, Mike, I've tried physio and it didn't work. And hopefully this little chat is going to help you guys dissect what you're saying there and understand why it hasn't worked so far. And also get you looking at your back injury, your sciatica, your herniated disc, in a slightly different way. And just before I get into the meat of this today, because I am aware that the title itself is could be perceived as a little bit provocative. Make no mistake, this is not at all a attack or in any shape or form on individual physiotherapists or the physio itself, right? As an osteopath, the stuff I'm talking about here will certainly be leveled at osteopaths, at chiropractors, at GPs, at any professional will have the same sort of flaws within their system. So I wanted to get that out of the way very clearly first and foremost, because they're going to be good and bad in all profession. So this is not that. But I'll start things off today with just talking about the biggest mistake that we make when you guys come into the comments and you say, hey, your physio didn't work for me. And just to let you guys know that if you've been struggling with lower back pain or sciatica for an extended period of time, more or less everyone that's ever come through the program or come to see us in the clinics that we've had, either with our clinics or in clinics I've worked at before, did not come to see me anyway, or join the program as the first port of call. They go to see their local GP, they go to see their local physio, they go to see So most of the people that I've ever seen have already tried rehab work, they've already tried physio, and then we get them doing rehab, which could be termed physio, which kind of leads into this first discussion, and they get better. So why is that, right? The first issue is the term physio. So if you're going on, posting on our videos, in the comments maybe you've tried physio yourself. Let us know in the comments, what specifically did you do? Because physio is often a catch-all term, and you guys don't know this. But there will be different ways in which, so if someone says, I went to an osteopath, it's like, that's fine. What did they do specifically? Because you're going to go to see a physio and you're just going for a consultation, you're having a chat, right? I went to see the physio, it didn't work. Well, if they were just talking, that's an issue, right? What were we expecting from that transaction? That's not the same as exercises. If I went to see physio and it might have been that I was doing some hands-on treatment, right? That's different, right? That's relief work. That's not rehab, not proper rehab. It might be that we went to physio and we just were doing some stretches. And I've got a specific example that I pulled just before today's live session to hopefully help some of you guys understand this in a little bit more detail and see why it's just so bad for these little low backs, right? Maybe we went there and we actually did do rehab with the physio. So there's a number of different things that we could have done when we went to the physio specifically. And so that in of itself is not helpful. The most important thing, if you're struggling with lower back pain and you're looking for help, you're looking for guidance, maybe even in the comments here, is say, you've got an L5-S1 disc injury. What specifically did we do at whatever appointment it was? I went to the physio and had a consultation. We spoke for a half an hour. I went to the physio and they showed me how to do this stretch. I went to the physio and actually they did some soft tissue work on my hips, right? All of these things may well be valuable, but we have to understand whether it's actual proper rehabilitation work that we did with the physio, that we did with the osteo, that we did with the chiro, that we did with this guy or that guy or whatever it is, or whether it was something else. A very, very important point of distinction. And then this brings us to the second issue that a lot of you guys will have when you go for physio or for those kind of appointments at the first port of call to help you with your lower back pain, because you make no mistake, especially here in the UK, you go to your GP or your medical doctor with your lower back issue and they will direct you to physiotherapy. Go and see the physio, right? Gizat has said, please fix my sciatica. Pay attention because this will be helpful, right? Pay attention because this will be helpful. So you're going to go there and the problem is, right, you're either doing random bending and twisting or you're kind of doing like just some random kind of stuff, right? It's a shopping list of exercises. And I pulled up specifically, I'm going to read you out the individual exercises that was on one of the UK, I won't say which NHS it was, but on the UK website, these were exercises for sciatica. A little routine that you can do. By the way, G. Zat that said, please fix my sciatica. This is not a good example of rehab, but it's a very common example of the physio that you might have done. Again, not an attack on physios, just this prescription of this kind of exercises, right? The first one was a back stretch, right? Lie on your back and rock your knees left and right. The next one was a tilt, lying on your back and doing a pelvic tilt. The next one was randomly in there was a lunge hold. Just stand there in a lunge position and breathe. The next one was they thrown in a random quad stretch, right? This is your back, this is your sciatica. Just do this, right? And I'm going to level a criticism. If you're doing this kind of stuff at your rehab, like you're going to daycare for adults with back pain. You're not going to physio. I mean, I'm sure many physiotherapists would be horrified if this was what they were, you know, what their patients thought was rehab, or rehab looked like rehabilitation, proper rehabilitation. Then there was hug one knee, which could be the same as like a piriformis stretch, and then just lie on the floor and breathe. What part of that is rehabilitation? What part of that is building resilience? What part of that is learning how to control your body? It's absolutely astounding that that could be called rehabilitation. That is a random selection, a shopping list of exercises. And unfortunately, some of you guys, that will be your experience of physio or of rehabilitation given by an osteopath. And that's upsetting for the individuals that are in that profession, that that's what is given. That's not rehabilitation work at all. Now, what you should be given, the solution here that you are not given, is structured rehabilitation. Something that is goal-orientated. Yes, we want to have some relief-based practices, things that can take strain off the injured or herniated disc in the lower back. We could think about the towel decompression, where we're putting a small rolled up towel underneath the lower back to create a elongation and a restoration and support of the natural lordosis of the lumbar spine, to take pressure off these discs. It could be that we're doing the bed decompression to elongate the spine, take a bit of pressure off the discs again. It could be that we're doing the second category of relief-based stretches, whereby we are mobilizing the hips without compromising the spine to make the hips a bit more mobile. It could be that we're doing some other treatments, maybe with a physio, maybe with an osteo, maybe with a chiro, to get the other areas of the body moving a bit better so they take the strain off the lower back. But that is relief work. That's part of an overall kind of program to recover from back pain or sciatica. But then we need to have the rehabilitation component, the rehabilitating the tissues that have been injured. Supporting and protecting this section of the lower back, learning how to stabilize and control the neutral spine, building up the strength around this area, improving our ability to move and control our body. Because it's not a foregone conclusion that a lot of people have this in spades. They don't. They're missing it. And then building the resilience of the load-bearing capacity of the actual tissues in the lower back that are injured. That is proper rehabilitation. But then it comes down to the last bit, and I'm going to get into some of the questions, guys. So guys, if you're live and you're posting questions, I will get to those in a second. Don't worry. We've got plenty of time today. We're going to be live for an hour, so don't worry, and I'll probably overrun like I always do. But the last part here is the truth, and this is putting it back on you guys. And this is from specific experience. And I know there will be a lot of individuals that are operating in large organizations that will feel a bit deflated. And this is on the part of the physio, the chiro, the osteo, the GP, etc. There have been times, and they are too frequent. One of the pieces of software that we used to use to give exercises to our patients, this is before we had the program in clinic, was this software where I can see if you've logged in and logged your exercises. And there's nothing more demoralizing than going through and spending the time to go through the exercises with a patient, and then to see them the next week, and you ask them about their exercises, knowing that they haven't logged into the exercises to watch them or log them for the last week, and they then proceed to kind of not say, I haven't done them the last week. And if I struggle to control what I'm doing with the patient in the room, I'm definitely going to struggle to get them to do compliance out there. And that is unfortunately one of the issues that maybe contributes to why the physio, the osteo, the chiro might feel a bit more reluctant to bother giving out rehabilitation, because they find, you know, I put the effort into this, I'm much better putting my effort into just doing a treatment in the clinic, right? And we'll hope for the best when they're at home. Because I keep on giving people exercises and they're not doing them. And that is a factor. So that's the honest discussion that also needs to be had. Now, that's not saying you specifically watching this haven't done your exercises. But when you're seeing lots and lots of people coming through and a large number of them don't, that is something that, you know, is incorporated into the practitioners that you are seeing's worldview. So, something to think about. Hopefully that's helpful for you guys. And I will say, in our experience, the nice thing about the way in which we structure the program is we see you guys doing it, right? You're sharing those videos, you're sharing them in the group, you're posting in the group. We can see that you guys are going through the material at the right pace for you, and that's really cool, right? That is really cool, and that is one of the very big differences we've had since having the program, is that we do have a lot of you guys that are coming through this want to do them, so you do them, which is great, right? So part of that is about mindset shifting and helping you understand that, you know, if the person is coming into the clinic, for example, trying to get help with their lower back pain or their sciatica, and they, you know, they're like, oh, can you fix me? That person is probably not going to do exercises, because in their mindset, they're coming to the table of, you're going to fix my problem. And so that fit for rehabilitation, that person needs to go through the learning experience of realizing that back pain is a you problem. Back pain is a problem that you recover from when you work collaboratively with a practitioner or resources online to get better. So that's an important caveat, I would say. So we got a lot of comments in here. Let me have a look at what we've got. So Andrew said he was born with an L4-5 fusion. Interesting. The last few months, really bad pain in the lower back, and now my mid-back, I can't train, I'm 28. There are lots of different congenital abnormalities. The very common ones that we see are things like sacralization and lumbarization. Typically speaking, this is going to be at L5S1 where these things take place, and you'll also see things like Bertolotti syndrome, where basically this last green one here is connected to the orange one, the sacrum. Right? This is your tailbone, this is the last lumbar vertebra. If you're born with these kind of abnormalities, it does mean that your spine has certain quirks to it that mean it's not quite as good, or it's not got the same level of adaptive capacity as maybe someone else who doesn't have those. But the next thing is also very important, and probably more important to understand, is that you've had it your whole life, but we've got a recent bout of lower back pain. We can still get injured, but we have to acknowledge that if we have altered structure from the ideal, then we just have to work a little bit harder on the rehab side of things, especially for this kind of individual if we have a congenital fusion, meaning that it was at L4-5, that it's one bone, right? It might just be one bone. In that sort of scenario, doing things like what we mentioned earlier, that NHS kind of bend your back, twist your back, etc., is going to be doubly worse, I would argue. Pav said, I have spinal problem at L4-5 and 5S1, sciatica. I've got disc bulge and pain down the leg, and now surgery. Most of you guys watching right now that have a lower back pain, so pain over here in the lower back, down into the buttocks, maybe towards the tailbone or down the leg, are going to be having injuries at this level of the lumbar spine, the L4, L5, the L5S1 segment of the lumbar spine. And that is the sandwich truck coming round, which I'll miss out on today, but don't worry. It's important to understand that a lot of what we're talking about is the same sort of thing coming up time and time again. And you'll see that on these lives, that people that are coming in posting their comments, it's the same sort of regions that are affected, but slightly different symptoms from one individual to the next. Kate said, I was just diagnosed with DDD, degenerative disc disease. Is there a best exercise technique to start with, e.g. yoga, lifting, etc.? Very, very good question here. Number one, I hate the term DDD because the last D is just not a very pleasant one, and I don't think it has connotations in your mind that are not particularly good, right? We think of degenerative disc disease. It's not a disease, right? And I think that's unhelpful to think of it that way and be told that, because it kind of frames the issue a little bit in an inappropriate way, and I think it's disingenuous, right? Not the criticism, it's just that term. I think we should kind of dispense with that a little bit. You can say degenerative discs, stop there. That's perfect, right? But the real issue with Katie's question is, which hobby should I get into, right? Yoga, lifting. You don't do that. You have a back injury. And evidently it's there for a long enough period of time to mean that the vertebra, instead of looking like this, nice and square, it's looking a bit like this, degenerative, right? Indicating the duration of the problem. We don't just start random hobbies. Yoga is a hobby. Lifting is a hobby. Golf is a hobby. Pilates is a hobby. Start actual principled rehab, just like I discussed at the start of the live session. Focusing on learning to stabilize the spine. Protect that area. It's probably L5S1 down the bottom here, or L4-5. Maybe both, one to a greater degree than the other. start to stabilize that area using exercises like the dead bug, the marching bridges, the squats, the hip hinges, the step-ups, single leg hip hinges, right? The ones that we talk about in the program all the time. That will mean that you will transition into lifting. And you might well get into some elements of hip mobility work later on down the line, which might well be the sorts of things that you might do in yoga. But just because some of those activities might be similar to the rehab doesn't mean that they are the same. They are hobbies. So make sure, guys, when you've got a back injury, do a program of rehabilitation. If it's ours, fantastic. If it's someone else's, that's fantastic too. But do an actual program of rehabilitation that makes sense to you, and that will allow you to get back into your hobbies. Wayne says, waiting for an op because I got a hole in my back. No idea how to follow on from that, I'm afraid. I'm sorry to hear that. Quite often, if you guys don't understand the problem that's there because the practitioner has given a very poor, or is maybe very poor at conveying that information, ask, what do you mean? You're saying I've got a hole, explain please. Can you clarify that in a different way so I can understand the problem a little bit better? What else have we got here? I need an opinion. I'm going to a neurosurgeon tomorrow. He wants to book for surgery. If we're talking about lower back surgery, always try and get 2 opinions from surgeons specifically. And your neurosurgeon might have a different opinion to your orthopedic surgeon. But get them to make the case. And generally speaking, go to the surgeon that is more reluctant to do surgery than gung-ho. Generally speaking. Now, if you've got presence of emergency red flag symptoms, then that's something that needs to be considered. But by and large, I would suggest that, especially if you've got a long-standing issue of lower back pain and no significant changes, i.e. the incorporation of red flag symptoms, the saddle anesthesia, the bladder and bowel loss of control, those kind of things, right? The cauda equina syndrome. Provided you haven't got those, generally speaking, a surgeon would normally be more reluctant to go down the surgical route. Now, there are different parts of the world where that may or may not be true, and that may be a little bit different, but generally speaking, that's what you want to look for. A surgeon that is viewing surgery as something that maybe they want to do, but very, very cautiously. What else have we got here? I'm just looking through some more of the comments in here. How bad is forward head posture? Forward head posture, your head is about the weight of a bowling ball, so the further forward you push it, the more load you're going to be increasing through the spine, and if you've got a lower back issue, it's not going to be particularly good. The nice thing is, just pull your head back. If you're doing vertical spine alignment and you're aligning your head over your shoulders, over your rib cage, then you're doing the right sort of stuff to align yourself correctly. And if you're not, ask the question, why am I not doing that? Just going over to YouTube, looking at some of the comments. Oscar, I feel some soreness in the top of my left shoulder blades. Could it be from the hip hinge and the squats? If you're feeling it in this sort of region here, one of the common mistakes, and Oscar, have a look at the video of you doing it recently, is that when we're doing our squats and our hip hinge in particular, we do this. Right? Look at my neck. That might be irritating your neck. One of the common kind of first symptoms of a neck issue is that we get a referral from the neck down to the shoulder area here, associated with the attachment site of muscles like levator scapulae, which runs from the middle of the neck down to here. That common error, that neck movement, is very common when people are doing things like squats and hip hinges, and you might be making that mistake there, Oscar. So it's not a problem with your technique from a lower back point of view, but it's that we're potentially nodding the head when we're doing that exercise. Lewis said, coordinating. All they said at the end of the 12 sessions was to, this might be talking about the chat about physio. He said, all they said at the end of my 12 sessions was to use my back more and to hold a seated squat every day. My back felt exactly the same as when I first started. Why would they approach it like that, I assume, is what we kind of followed on there for Lewis. Yeah, I mean, if that's your physio, that's tough, right? Why are we doing like a wall sit? Right, a seated squat every day, right? That's probably what they mean is, that leaning against the wall and holding the sitting position. Because what is it doing? It's just strengthening your quads a little bit, but it's so hard to scale that kind of stuff. It's got no applicability to daily life. If you remove the wall, you'd fall over. Unfortunately, that is exactly what we discussed earlier on. That list that I got from the NHS website for sciatica, that's probably Lewis, what you've got. You had someone looking after you and got you doing those things. And it's like, why were we expecting any change in 12 sessions? What were we actually measuring here? These are important questions to ask, well, we're not doing that anymore, Lewis, so that's fine. But, it's just another example. To be fair to the guys that are trying to help you guys, there are lots that are good, right? Not everybody is using this kind of approach that Lewis has experienced or that I pulled up from the internet, but it's used quite widely, unfortunately. Youth Clubber says, how squat can help us in the back injury and sciatica, because it's a back exercise, but hip hinge makes sense because it's a lower back strengthening exercise. These are great questions because asking these questions helps you understand things better. A squat is a hip hinge with a knee bend. For some people, when they're doing the hip hinge, why are we using the squat or the hip hinge? And I'll make the distinction between the two. To rehabilitate our lower back injury, our herniated disc, maybe with or without sciatica. The squat is a very learnable exercise, and so is the hip hinge. It's a very stable exercise, meaning you've got on both feet, you're stood particularly still, and you're kind of doing that or you're doing that, right? We're balanced, as opposed to, say, the single leg hip hinge where we've got an extra component of off-balancing to contend with. What is our goal of rehab? In the short term, both the squat and the hip hinge are teaching us how to perform a skill, a movement that we do every day, getting up and down out of chairs, with more control of our spine, brushing our teeth, right? Washing our hands, etc. Hip hinging rather than bending over. So they have that technical skill, which we can build in minutes to hours. We can make improvements, right? Very, very quickly. The second kind of mechanism for them helping is that all of those, if you don't think a squat builds your back muscles, then you're not doing something right, okay? The squat does exactly the same as the hip hinge. Why? Because when you do a squat, there is a component of hip hinge in there, right? So the squat and the hip hinge both build the lower back muscles. They both build the core. They both build the legs, although preferentially in the legs, they're going to focus slightly differently, right? With the hip hinge being a bit more focused on the hamstrings in particular. As we go down a little bit lower, glutes, etc., coming in there a little bit more. And the same for the squats, although the squats may be a little bit more quad dominant to start with, especially if you're doing more shallow squats, i.e. not going as deep. But they are all building the musculature around this whole area. Both the same, fundamentally. There are going to be some nuanced differences, of course, but they're doing the same sort of thing with slightly different movement patterns. The movement patterns are important, right? The second thing is that for some people, as they are progressing, the squat offers a better route to scale the load because the squat often doesn't have as much of a hip hinge. Even with a neutral spine, the loading in this section of the lower back and on the musculature, etc., increases significantly the closer to horizontal we get. And for some people, even with a neutral spine, that is extremely limited. So they can continue to progress the squat in a more scalable way. The question is, if I'm holding a 5 kilo load here and I'm doing a squat and my torso is doing a little bit of a hip hinge but not that much, it's reasonably easy to predict what the load is, right? If, however, I'm holding a kettlebell or a dumbbell and I'm going into the hip hinge position, the 10 kilo, the 5 kilo that I'm holding is going to exert more strain on my spine the lower I go because it's got more compression because the weight is moving further forwards. And so for some people, they find it's a little bit harder to, at the first instance, build with the hip hinge. So they can make more progress objectively, going up in small increments through the squat than the hip hinge. However, the hip hinge is also teaching that important skill of isolating hip movement only, which a lot of people struggle with. So you're building up both of these at the same time, and at different periods during the process, you might find that you favor one over the other. The other thing to consider in this equation is the knees. A lot of people with the weaknesses that lead to lower back injuries that don't recover very quickly also have the same weaknesses that predispose the knees to being weak, vulnerable, injured, irritated, or having bad knees. And so you often find that actually the person maybe needs to lean on the hip hinge for a little bit longer because their leg muscles need to catch up because their knees are a bit of a limiting factor. So you have this pairing that you will lean more into the squat at certain times, more into the hip hinge at others. Later on in the recovery process, the hip hinge can be used in itself to actually improve the range of motion at the hips as well. So there's a lot of thought that goes into these things. And thank you for the question, Youth Club. And I could probably go on for even longer talking about that. But that's the kind of explanation that your physio, your chiro, your osteo, your doctor, your surgeon should be able to give you with their chosen modes of helping you. They should be able to talk about it in that kind of way to help you understand how it's helping the injury. Learning a technique to make you safer, building the muscle around there, and then building through the application of load, the actual driving the strengthening process of these injured tissues. And then there's reasons why we've got one and the other together. And obviously we do them on separate days in the program. Mitchell has said, should weighted hip hinges be the same weight as the squats? Also in the morning, especially after I lifted a moderate weight, my hips are stiff on one side until I warm up with the walks. So number one, I don't know what a moderate weight is and how that compares to the rest of daily life. So that's something to consider, because often, especially in the early stages, the simple load of sitting down is more than we might be using in a squat or in a hip hinge. Secondly, with regards to the weight that you're using, for reasons that I mentioned a moment ago, some people will find that they can accelerate the loading a little bit more in the squat and the hip hinge needs to lag behind. And then for other reasons, they can actually push the push the hip hinge on ahead of the squat, because maybe other areas like the knees, for example, might be holding them back. Shannon said here, I've been going to the GP and physio for 8 months. They won't refer me for pain management without diagnosis. Again, Shannon, what kind of physio have you been having? What exercises have you been doing? What have you been doing with the physio in those appointments? And quite honestly, the GP should actually be able to diagnose you. So yeah, that's reasonably odd that they would say that. They should do an examination and a diagnosis. That's fundamentally why you go to see them, right? you should have some kind of idea, right? They might say, we suspect, Shannon, that your symptoms might be associated with a disc bulge at L5S1 for XYZ reason, because of this, that, and the other, based on the testing, blah, 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 blah. We could confirm this with an MRI if we wanted to, but it should get better if we do some blah, 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 blah. You know, that's what should happen, and then they can maybe make a case of whether they want to. So Shannon says, physio's useless, never assess my movements, or just gave me printed out or relevant exercises. Kind of like the ones that I discussed at the start of today's live session, I'm sure. Probably some twisting and bending of your back. Probably, you know, like we had on the, as I mentioned earlier, guys, for those of you entertainment that have come in late, it's not entertaining, but it kind of is. If we can laugh a little bit, maybe it makes it a little bit easier. Let's do a quad stretch for back pain. Like, why that's been added in, I'd love to see the person try to do the mental gymnastics to justify why that's an appropriate stretch to bring in. Maybe it's because they're like, you couldn't possibly mess your back up any worse by just doing that, right? That might be the actual rationale. I have no idea. I'm sorry. Andy said, my experience of physiotherapy has generally resulted in flare-ups of back pain and spasm. One saying that exercises for shoulder and knee pain have been more helpful. I just think the back is a little bit more complicated. It's not the same as the other synovial joints. It's not as predictable. It's not as easy. The things that you've injured are, like, you don't have the capacity to control L5S1. Whereas you do if you've got a bad shoulder. You do if you've got a bad knee. You can see that, this is the bit that hurts. Okay, I've got to be really careful, really careful. Okay, go through there. You don't know how much L5 is moving when you're doing the bending and twisting. It is a little bit more complicated. And if we stop treating the lower back like another synovial joint, and we start to understand that it has some nuanced differences. First of all, the fact that you can't actually control the injured joint that you've got, that can make a big difference, right? You wouldn't go into the physio and go, right, what we're going to do is we're going to just keep cranking through that pain and just keep cranking it, right? They go, no, we know it hurts here, so let's just going to go to that, just on the cusp of pain-free, etc. And you know how much abduction is actually happening here. You can see it, you can measure it. You can't do that with the lower back. And you have to acknowledge that. Shannon says, do you think it's worth praying for a private physio, a private osteopath? Using a good private osteopath or physio or chiro can really help you, but you have to have rehabilitation work. You have to have rehabilitation work. You've got your education and your rehabilitation, which forms the foundation. A lot of you guys will get better with just that, right? But if you want to leverage extra things, then you build on top of that. If you're doing a physio or an osteo appointment or a chiro, maybe you're coming here and you're going on the decompression table behind me, behind the wall. Maybe you're doing that. But if you walk out of the treatment room and you're bending your back all over the place, doing all sorts of things because you haven't been given guidance and you haven't been given rehab, you're just going to undo the good work that I'm going to do in the clinical appointment. And that's an important thing that needs to be discussed. We're not magic. Yes, we might have invested in some really cool tech that can help you. Yes, we might have some really good techniques as an osteopath doing more hands-on stuff, or maybe, you know, the chiro, etc. But it's not magic. You still walk out unhealed. You walk out unhealed because the tissues that you've injured in your lower back heal over months. They don't heal over days, minutes, and hours, right? They're not skin tissue. We can't change them to skin tissue so they recover, so they have the metabolic rate of those tissues. And the lower back, again, is one of the areas where, unfortunately, unlike a knee sprain or an ankle or shoulder, because Andy mentioned the shoulder, you don't have a second one you can use for the next couple of weeks while this one goes through healing effectively. Tara said, it didn't make sense to me. This is where the education really comes in for Back in Shape. Understanding why those exercises don't work for lumbar spine injury. Yeah, it's easy to poke holes in things, right? On our part, it's easy for us to poke holes. But hopefully explaining some of the why helps you guys understand. Because you have to realize that you could be doing the best rehab in the world. You could be doing the program, right? But if you finish, and I'm going to actually reiterate something from the other week, right? If you are not applying the principles that you're learning, so for example, if you're doing that those NHS exercises that I called out to you guys earlier on, right? And maybe some of the stuff that you guys have done, right? Just random stuff, right? You're basically at a daycare appointment for adults with back pain, as I said earlier. If you're doing that, you're not building any skill. But if you're doing actual spine stability work and learning how to control your spine, etc., you need to know that you have to apply that to the things you're doing in daily life. So we had one of the guys the other day, and I know it happens all the time. I just caught him out on the video, and it was great of him to actually upload the whole video so I saw it, right? Because then I could comment more accurately. And he goes and picks up the bar. We'll pretend this is the bar. He's got 30 kilos on here, done great work to build a really nice hip hinge. And he goes and picks it up like this. Puts it on the block, right? And then picks it up again, and then proceeds to bang out 10 really nice hip hinges, and then puts it back down on the floor again, right? What's going on? I pointed it out. He goes, yeah. Whoops. Right? You have the skill to execute a really nice hip hinge. Make it a habit that occurs outside of the exercises as well. And if you don't have education to go alongside what you're doing, you often don't know to make that application. It's really important. Most of the reason that you guys struggle to get better is because of flare-ups that are happening in the real world. They're happening in the 16 hours of the day that you're not doing your rehab, that you're not doing your exercises. That's not to say you should spend all day doing rehab, but we must learn those things and then apply them to our daily life. Oscar says, if I have L4, 5 and S1 disc bulges, but the pain is not running into the leg or tailbone, is that a sign that it's healing? Generally speaking, if we have had symptoms that are in the leg or referral symptoms of sciatica, and we find that they are receding back towards the spine and the lower back, even if we didn't have lower back pain before, we just had symptoms in the leg, that process of what's called centralization, moving back to the center, is generally considered to be a good sign. Oscar said it's below the shoulder blades with reference to the earlier bits. I'm not sure, Oscar, if it's that same area that we discussed before, but make sure when you're doing those, you are doing a nice chest pop with reference to our earlier discussions on those x-rays that you uploaded. When we're doing these, make sure we really have that popped out like so, right? We're not running the risk of letting the thoracic spine up here fold over. I've seen it, they're good, right? It might be that we're scaling back in because we had like a month or 6 weeks off training. It might be that we just scaled a little bit too fast, right? So that might be something to consider. But by all means, give us a little bit more info in the members area, especially if it's below kind of what would be the bra strap level. How can your shoulders bleed? I think you meant shoulder blade. Squat is the king of exercises. It uses every part of the body in some way, shape, or form. Yes, the only thing I would say, Narav, is that the hip hinge, I would say, uses your hands more, your grip strength a bit more. I think that's something that's lacking. You see some of the data on the grip strength of men and women nowadays compared to what it was like 50 years ago. There's a significant drop. Oscar, blades. Oscar and Mitch are having a good chat there about shoulders bleeding. Just looking at some of the other chats here, guys. What else have we got? What is the best help? The pain makes me cry. Guys, hopefully what I'm discussing here is helpful for you. Those of you guys that are struggling with lower back issues. Someone says fear-mongering tactics. basically proved you wrong. I don't know what we're talking about here. And atrophy. I've been told I have torticollis after neurosurgery. Any advice on gentle exercises? If you've got any other, grip strength is another gift. If you've got any other symptoms, like if you've been in and had a surgical intervention, you need to have a close relationship with the surgical team. That should be discussed before you go and have it, right? I've used the case because it's fresh in my mind, because I've been discussing it recently. That case where one of the guys posted on TikTok when we were doing these lives, and said I paid like £10,000 to £15,000 for a back surgery, and I was just left afterwards, just sent on my way. If you're going to see anyone for a spinal surgery, it's a serious operation. You guys know that. You guys don't want to have it, right? In most cases, okay? Make sure that they are instilling you a feeling of comfort that this person is going to support you. Maybe they're not the one, probably they're a surgeon. They're not the one to help you with the rehab, but they are giving you a nice complete package in that, yeah, I may be doing the surgery, but you've got the support outside of the surgical environment afterwards and before to make sure that we can capitalize on this procedure that we perhaps didn't want to initially do. Make sure you're seeing a good team, right? And that goes back to what I said at the start of today's live session, right? The topic of this conversation of, why your physio failed you isn't an attack on the physiotherapist or an individual physio. You can get good and bad in all domains, and you can get the same in surgeons. You can get good and bad surgeons. You can get good and bad osteopaths, right? You can get all of that. So just make sure you try and see a good one that genuinely, is trying to help you and provide you with the best possible approach. Sheffer says, what do you recommend to get out of a flare-up or spasm? Start the rehab. I was doing a comment earlier today about this because so often you guys, so I'm in the acute phase. I shouldn't be doing rehab. I'll start my rehab when I get out of the acute phase. It's like, no. You are perpetuating the acute phase by not doing anything constructive, right? And Nirav said here, Nirav said in the program, Limitless, everything is covered down to the smallest movements, right? When we are in a flare-up, education matters. If you're in a flare-up and you're saying, I'm so bad I can't do my rehab right now, what else are you doing every day? Now, in the worst possible case, you're just lying in bed, losing muscle mass, which is a problem, by the way. But even in that scenario, you're going to be going to the bathroom and coming back again, which means you're going to be rolling onto your side, you're going to be getting out of the bed, you're going to be going to the bathroom and then coming back. So you're doing a bunch of stuff, even when you're in a flare-up. Why are you not doing rehab? Why are you not carefully learning how to engage your core? If you're that bad and you're not doing anything, because no one does nothing, right? Even a tree that's there is photosynthesizing, so no one is doing nothing, right? That's a falsity to say I'm not doing anything, right? Even if you're doing very little, great. You've got time to cover educational videos so that when you do eventually start getting back to doing stuff, you don't mess yourself up. Because up here makes a big difference. That knowledge makes a big difference. Knowing what you don't know is important, and that's why there is such a heavy component of education in the program. So if you are in a flare or having significant spasms associated with your lower back pain, with your sciatica, with your herniated disc, start the rehab now. Because the point of the rehab is to get you out of the flare-up faster. If you're learning how to engage your core, you're not going to be messing yourself up when you get out of the bed. You're going to start to be able to do that with in a more effective way, in a more back-friendly way. You're not going to be bending this all over the shop when you go to get out of bed. You're not going to be doing this on the side of the bed going, oh, gosh, right? You're going to be thinking a bit more. You've got some cues because you didn't have those before, right? Someone said prehab before rehab, right? Prehab is helpful, right? Prehab before surgery, Very important thinking about. We engage, we set ourselves on the side of the bed, we get our knees underneath it, we come straight up, we engage, we move. Oh wow, I could get, the amount of times that someone will come in and say, I'm in so much pain when I get out of a chair. And then you look at them getting out of the chair and you go, I'd be in pain too if I was doing that. Maybe not quite true, but, right? And so you educate them in that moment how to get out of a chair, how to control themselves, how to position themselves, etc. Now, the great news for that is that's accessible to anyone because we've got a ton of tutorial videos that explain to you guys how you should control your spine, what a neutral spine is, how to engage the core, squats, etc. But in that moment, getting out of a chair went from painful to pain-free. It was just learning how to do it properly. Now, why would you rob yourself of that just because you're in an acute flare-up or an acute phase? Wouldn't that be helpful? During that acute phase, if you could do things in a way that didn't aggravate you, not nearly as much, So you start rehabilitation immediately. Ideally, you start, the biggest problem with the rehab for a lot of people that do not get better after back pain is that you probably should have started the rehab before you ever were aware you had an injury. And that's the simple truth for too many people. Amanda said, how often and how many times a day should I be doing the squats, step-up routine? I've had sciatica for 6 months and just found your program. The best thing you can do, Amanda, is get stuck into the strategy material in core phase 1, if you've just started the program, and the core relief work. You are going to start off doing the phase 1 routines daily after you've done the work with the tutorials, which is explained in the strategy material. And then it will change and evolve from there as you move through to phase 2 and 3 and so on and so forth. Limitless said, my physio was good. He did all the checks and provided squats and hip hinges, but felt like it was a, here you go, here, you know how to lift weights off, off you go. No daily activity was considered. Yeah, so one of the failings, I think, is that the person is so focused in the treatment appointment or the consultation appointment that they maybe neglect to realize that, you know, you have to live and exist in the real world, and that does need to be factored in, as we've been discussing there, right? It does need to be factored in, your daily life. That is a huge area of opportunity for you guys to limit, to mitigate the constant aggravations that are being placed upon your lower backs. Lewis said, finished phase 1 and the live session felt excellent. That's awesome, Lewis. As per the videos and the comments that we had in the members area, oh, you nailed the true hip hinge instead of the hip squat. Yeah, that's cool. So just to touch on that for you guys, right? One of the mistakes that people make when they do a hip hinge is they do, instead of doing just a hip hinge, right? They do a hinge squat, right? That's as far as you can go, and then you start kind of like squatting down to go further. And when you get there, if you try and straighten your knees here, you can't, so you come back up a bit, and because the hamstrings are affected by 2 joints, the flexion at the knee and the flexion or extension at the hip. And so we're just trying to hip hinge, so we don't want to bend our knees. If we bend our knees, we can get more of a hip hinge because we've shortened the muscle from this end. And so one of the drills is to actually get that true representation of this is how much flexibility I have. Why is this important? Because Lewis has been using heavier weights in the past, and it might well be that actually he can build back up to those heavier weights relatively quickly, Lewis specifically, right? And actually when we start doing a hip hinge properly, we realize actually I'm quite limited in the hip hinge. And therefore we might be focusing, as we build up the load to a certain level, we might say, do you know what, we need to build back in a little bit more, or build in a little bit more flexibility work using the hip hinge specifically as a mechanism to increase our range of motion there, because that's a parameter that's going to be helpful for him. It's common that people that don't have necessarily the best flexibility, not always, but the best flexibility in the hamstrings will often do the squat hinge because they're trying to compensate for the lack of flexibility in the hamstrings at the hips, so they bend the knees a little bit to allow them to go a little bit lower. The very important principle with your exercises, don't try and do a harder, and this is kind of going off topic from Lewis specifically, but don't try and do a harder variation. Just because you know you should do a squat lower down doesn't mean you force yourself to do that if it's aggravating you, if it's incorrect, if it comes at the cost of your lower back, right? For example, people often say, oh, well, can I put something under my heels because I haven't got very good dorsiflexion in the squats, right? So if I put my heels up, now all of a sudden I can squat down a lot lower. No, you need to have an appreciation for what your current level of competent, correct technique movement is, so that you can understand how good or not your lower back is. It's very important that we don't rob ourselves of the applicability of our rehabilitation to our daily life. What else have we got in here? Recovery can be years even with rehab and body weight. Recovery can be years even with rehab with body weight loading via the squat and RDL. I'm not so sure what we're saying there, Nirav, but rebuilding the proper strength in the lower back is a process that is ongoing for the future, period. And then depending on what we want to achieve from a hobbies point of view, an interest point of view, we probably need to be stronger than even that, depending on what kind of physical tasks we want to do. We then need to consider the appropriate level of strength for the tasks at hand. Now, if you just want to potter around in the garden, you probably don't need to be as robust and individual as if you want to be doing something like jiu-jitsu, for example, for me. Lewis says, is it normal to have some tightness and feeling the back stabilizes in the erector spine During the hip hinges today, did about 70 reps yesterday during the live sessions. When I next perform the movement, let me just reread that again. Is it normal to have some tightness feeling or feeling that the back is stabilizing during the hip hinges? If you've just started working, especially in a refined way with those hip hinges, it's certainly not unreasonable for you to feel a little bit of delayed onset muscle soreness, so DOMS, or tightness the next day. But I would suspect that will subside pretty quickly in your case, Lewis, anyway. And with regards to when you should next perform the movement, I think you're ready to look into phase 2. So we need to be getting into that now. Leave side planks out. Just follow it to the letter. Follow the program to the letter until you get to the 4th phase, and that's when we talk about adding in other things. Just follow it to the letter, okay? Don't add in extra bits, please. Limitless says my grip strength has tanked. What else have we got in here? What specifically can you do to quiet the pain in that moment? Chef has said. You've got relief strategies, contrast bathing, right? Unfortunately, you know, it's difficult in some cases because you're constantly aggravating your lower back and have been constantly aggravating the lower back for such a long time. It's kind of like saying, what do I do to quieten the pain after I stub my toe on the corner of the door frame, right? We can get into those kind of things, but they're temporary bits and pieces. If we start to engage in the rehabilitation process, in the relief-based practices, we can have strategies that start to settle things down. Most of the time, one of the things in jiu-jitsu, this will not be relevant for many of you, but I'm going to use it anyway. When you're in a choke or a submission of some description, sometimes you say to the coach, you say, "Coach, what do I do to get out of this position?" And the answer is, don't get into that position, because there isn't an answer to get out of that position. If we've just done certain things, if I've just decided to go and do this, that, the other, sorry, you're going to have to endure the pain because unfortunately we flared it up because we've done something unwise. The good news is if we're doing relief-based strategies, contrast bathing, if we're doing some massage going, etc., we can bring it back down relatively quickly. So that's worth bearing in mind. It's not a complete thought, but we'll probably go through that in a little bit more detail another time. Henry said he had an L5-S1 prolapse, but it healed pretty quickly. And now he's running and lifting, etc. But I've still got a weak calf. So the good news is, guys, your body, when you've got these herniated discs, it is trying to heal every single day. Make no mistake, your back is trying to heal every single day. And it actually, if you do a good job, like if you injure your back, you back off quickly, right? Especially for those of you that have a good degree of conditioning anyway, which isn't necessarily that many people, right? And you're given the right guidance, it'll settle down pretty quick. Now, if you've got any other issues that are symptoms that you maybe didn't quite realize were symptoms, it might be that it's calmed down, but it's not necessarily healed. And so jumping back into running might be a little bit premature if we haven't done the proper rehabilitation work. And I would suggest, because Henry's also said, why does the hanging leg raise for abs seem to be the only movement that's really flaring me up? Because when you do a hanging leg raise, you are literally hanging, and I'm going to do it very, very roughly here. You are literally doing that and rounding your lower back, right? You're literally repeatedly rounding your lower back. I would suggest that's not necessarily a great move. I'd focus more on spine stability work to build back up strength and resilience. I'd be careful of dialing the running up too fast if we don't have evidence to suggest we've rebuilt the back's ability and capacity to bear load. That being said, you know, there will be lots of people, I'm fully aware, that will just go back to doing things and they manage to get better. They manage to get better quickly. But for a lot of others, a significant number of others, you need a bit more structure to go through the rehabilitation process. And it might be that Henry's perhaps tripping himself up by trying to do some of these things that aren't necessarily goal-orientated, right? Running is the hobby. Rehab is the plan, the goal-orientated strategy. But when the pain starts to settle down, the motivation to do specific rehabilitation work kind of starts to go out the window. Mitchell says, I've been to a chiropractor once who cracked my back years ago, never again. He made me sign a waiver in case he totally paralyzed me. Yeah, I mean, that can be quite disconcerting if you're having to do that. Limit says, I've had this odd feeling in my core that my core is not stable when moving around. Sometimes it's like my body is protecting the spine. Is any Any jerky sensation in the core, any idea? I would work on actually, like whenever you're doing anything now, you want to engage and then stabilize, so you're providing yourself a bit more stability. If you're going to go down here, you engage and then come down and do whatever it is you're going to do. If we're feeling like we have a lack of stability in the spine, then provide the stability from the muscles, is what I would say there. Any information on functional scoliosis and how the program helps? I think it's important to differentiate between the actual amount of scoliosis we have. How was the scoliosis diagnosed? However, is it being exacerbated by the fact that we have an injury in the lower back, or are we just talking about the observation that the spine has this deviation left and right in it? If it does have this deviation left and right, and we're not going to suggest that we can correct that, then building stability for a less than optimally balanced spinal structure is quite important. And having family members who have significant scoliosis in the lower back, I would suggest it is very important. So the way the spine works is we've got very good support here, okay, to allow us to be in these sorts of directions, going forwards and backwards. The muscles are set up in a good way. We are set up to be straight here. The problem arises as soon as we deviate to the left, now all of a sudden the muscles on this side will more easily overpower the muscles on this side because they're shortened. And the easiest way to understand this is through a bicep curl. If I do a bicep curl from here, because the bicep is shortened, it's in a much stronger position to curl more. If I sit back in this position with the bicep fully elongated, it is much weaker. So this bicep fighting against this bicep is going to win all the time. So if we have a bending to the side through our spine, it's very easy for this to perpetuate over time. Firstly, gravity is helping it continue to go this way. And secondly, the muscles on this side are just going to get more mechanically advantageous as time goes on. And so the best thing I can suggest, because I'm not going to say we're going to fix scoliosis and things like that, but is to build your capacity for load bearing in the neutral spine as best you can. That's what we do in the program. Wisdom says, I'm paying $5,000 to the... Oh. That's obviously a scam. So we'll remove wisdom from the chat. Anyway, would vibration plate help with lower back problems? I don't know, Lisa. It might well be something that feels nice in the moment, and it might well be helpful in that regard, but I would suggest that puts it in the category of relief-based practices. I think I'd struggle to suggest that it's going to help you build strength and resilience in the spine, although some might be able to point to bits and pieces of research that might talk about doing squats on a vibration plate might be helpful. But I think we're probably getting into the weeds a little bit there and maybe overreaching with regards to how impactful using a vibration plate to, as part of our rehab can actually be. RDS says, I've tried all the exercises known to man for my L5 S1 disc bulge with Modic type 1. RDS, you definitely should have checked out the start part of the live session, right? It's not about the exercises. Exercises are not the same as actual rehab, okay? Please bear in mind, those of you that have just joined the live session, if you're struggling with lower back pain, if you're struggling with sciatica and you think you've tried exercises, more or less everybody that's joined the program has done a squat before. More or less everyone that's joined the program, or a significant number, have done a dead bug before. What's different in this scenario? Why is it different? Because doing an exercise is just another movement, right? It's just a movement is probably the better thing to say. And what is the expectation around doing exercises? And this is where, RDS, if you're still live with us, comments can be really helpful, right? To clarify these sorts of things. But too often there are expectations on exercises or movements that aren't fair, right? For example, expecting a hammer to be able to screw in a screw. No, a hammer can bang in a nail. If you expect it to help you put that screw in the wall, you're going to be sorely disappointed. And too often there is this expectation, I did my exercises and they didn't make me feel better. Well, they're not supposed to. In actual fact, when you start doing spine stability exercises, you're probably not very good at them, and they're probably going to feel a little bit aggravating to start with because you have to learn how to do them. And learning how to do anything invariably involves some degree of error. And then we need to think about, okay, well, what's the purpose? Okay, we've got the purpose of these exercises for our lower back injury they are relief strategies. They are relief movements, relief practices. They are not building any strength or stability into our spine. They are just helping offset the stress and strain of daily life so that our back has an easier time dealing with the stress and strain that I'm having to put it under, considering the fact that I've got L5-S1 disc bulge with modic type 1 changes, right? And that's in the L5 vertebral end plate and the S1 vertebral end plate that we're talking about there, right? A complete injury, one could say, or demonstration that this section is under more load than it otherwise should be and failing to deal with it effectively. And then we've got these other exercises that are actually strength building. Well, what's the expectation with those? I try the squats today. Am I expecting to feel better today? No. But some people might, because they haven't been explained to them why they're doing the squat in the first instance. And so in that sort of scenario, we haven't communicated the fact that the squat is an exercise that is going to be used for the process of strengthening. And whether strengthening takes place or not depends on how we do the squat over the long term. And then we look back and see if the process of strengthening occurred and to what degree. Now, if we've gone from squatting our body weight to squatting with 5 kilos, as a human being, that's not appropriate. So you need to go further. My wife says, you explained it perfectly with the spine representation. I'm glad that helped. Over a long period of time with multiple flare-ups, it has shriveled up more because of the muscles doing exactly as you said. Yeah. You've got to work to oppose that. If you've got scoliosis, you really need to just work to build your load bearing capacity. Do like within aggravation-free limits, acknowledge that there is the tendency for, because we've got that deviation, there's the tendency for it to try and get worse over time because of just the load of gravity. But if we can build our tolerance, our ability to bear this, then it's the best thing we can do long term, I would argue. But I'd be interested to hear any counterpoints there, especially if they're suggesting that would be a bad thing to do. I'd struggle with that because you're a human being that has to exist in the world. You're going to maybe have kids, maybe have grandkids at some point if you don't already have them. You're going to want to interact with them. You're going to want to go and do things in the world which exerts load on the spine. You can either prepare yourself for that, knowing that we've got some baked in disadvantages by way of the scoliosis, or you can just wing it. And I think winging it is not a recipe for success, not long-term success anyway. So that's something worth bearing in mind. I think I'll finish up on today's live session with the bank balance analogy, because hopefully this will be helpful for those of you that have tried rehab before. You're maybe in the process of doing rehab, and maybe you're even doing the right rehab, but you're starting from a low bar. And a lot of you guys, unfortunately, are starting from the point of which we could liken your current conditioning to a bank account with minus $100 in it. And so you go to the shops and you try and pay for something. You try and exist in the real world, and you go to the shops and you pay for something with that card. You try and buy something and you get declined, and it hurts, right? Because your bank balance is negative $100. That's just like you trying to go to do that thing tomorrow with the kids and your back hurting as a consequence because you don't have enough money to pay for that thing, right? You don't have enough attributes to deal and protect with your back, or protect your back, sorry, so that you can go about those daily tasks. And then you might start making some savings, some deposits into the bank account. You deposit $20 tomorrow afternoon, and you think, hey, I've done my rehab. I deposited money into my bank account. I've made some improvements. You deposited $20 into your bank account. You go and try and buy something again the next day. You try and do that activity again. Ouch, it hurts. Well, of course, right? You're still minus $80. You can't buy stuff, I'm sorry. You can't buy stuff. It hurts again. Now this goes on and you get to the point where you've got down, your bank balance is now minus $10. And you go and try and pay for something. You think, man, I've put in $90 into my account. And you go and pay for something, and you still fails and you feel despondent. But you have to, in that moment, you have to look back and say, my bank balance was minus 100, and now it's minus 10, and I am making progress. And I can see that on the rehab. That is what your rehab process is. You can see measurable changes in the rehab, even though the same metric of can I pay for stuff with my card is the answer to that is still no. Even though I'm still experiencing pain on a daily basis or on a weekly basis, or I'm not able to do the things I want to do, you still have minus 10 on your bank account. You haven't made enough progress. But then one day, a magic thing happens. You now have $3 in your account because you just deposited that next check, that next transaction. And now you have $3 in your account. You go and try and buy something. You're like, I bought a chocolate bar. Happy days. You did that little thing. You went for a drive for 20 minutes and you didn't have terrible pain. You paid for the chocolate bar and you didn't get your card rejected. You're over the moon. You then decide the next day, I'm going to try and buy a flat screen TV for $200 because my card now works. I'm not in pain after I did that thing. You go there and you pay, declined again, you're in pain again. Because you weren't conditioned to do that thing, even though you had made significant progress. You hadn't gone that far. Your bank balance was only $3 and you tried to buy a flat screen TV for $250. You're not that guy yet. You're not that girl yet. You haven't built that resilience. Have you made progress? Yes. You've gone from minus $100 to plus $3, but you've still got work to do. But then as you continue to make deposits into your bank account, the bank account of your body, your resilience, etc., making progress through the program, building the loads that you're using on the squats and the hip hinges. Now all of a sudden you have accumulated, it might have been a couple of months, it's not a couple of days, right? You've now accumulated $1,000 in your account. Now, most of your daily life, when you're spending money on that card, it's cool. It gets approved. But you want to go on that big holiday. And that big holiday is $2,000. You might still get declined. Now, obviously, you guys get the theme. You get the direction this is going in. Hopefully, it's helpful for some of you guys who are feeling a little bit despondent, that you've been doing some rehab, you've been making some progress. Shouldn't you be there by now? But have an honest reflection. Do you actually have you made enough deposits to build you up to the point where you have a significant bank balance? Have you made enough progress on your rehab, building enough of resilience in this lower back, as is demonstrated by your bank balance, as is demonstrated by your squat with load? Or have you not? And that's the question. And when you've got to $1,000 in your bank account, do you think that's enough for me? No, probably not. You continue to make progress. You continue to make progress. Hopefully that analogy, that bank balance analogy, helps resonate with some of you guys and helps you think about it, because it can be quite disheartening to be struggling for a long period of time with a lower back injury, thinking you're doing the work, making progress, going from 0 body weight on a squat for 10 reps to 5 kilos to 7 kilos to 10 kilos, right? But just remember to take a step back and look at things in the context, say, how far have I come? Great, I've come a long way. I am making progress, but I've still got a long way to go. It's important to reflect on those things. That's one of the reasons why we push all of you guys in the membership to take videos of yourself when you're doing the rehabilitation exercises. Record your squats, record your hip hinges, record those, because actually going back and looking at those, sometimes when you're feeling a little bit despondent, you've had a bit of a flare up, you're partway through, and going, man, that's where I started. Because we get used to the day-to-day very quickly, and we forget the pain that we're experiencing. Thank God we can't experience the pain more than once by just thinking about it, what it was like. We get very used to the day-to-day and we forget the dark places sometimes, or we can't feel, thankfully, those dark places that we've been in before. Tara said, I think my bank account is well in the negative, probably why I'm having calf issues. Progress is ongoing. I hope that analogy helps you guys think about things and put things into perspective, because it is a longer journey for some of you guys than others. You know, Tara, for example. But it also helps you say, man, if I've done this, it gets easier, by the way. The further you get, it turns into a positive feedback loop. Lots of you will be familiar with the negative feedback loop that got you to where you were in the first place, right? You more pain, so you do less. You become more vulnerable, so you get injured more frequently. So you do less, so you become more vulnerable. It's just going down in one direction. And as we start to make those little wins, that same negative feedback loop that becomes self-reinforcing, well, the positive one becomes reinforcing as well, especially if we really pay attention to the present moment and see how we are progressing. So I'll leave you guys with that. Those of you still watching, if you have been struggling, if you're in the program, if you're in the membership, please, we're there to help you in the members area. We are actually going to be live again tomorrow instead of Friday. So if you guys have any questions, any comments, you want to join on the live tomorrow, the notification will go out tomorrow morning for the live, which will be around about the middle of the day tomorrow. More details to come. Those of you that are watching, if you've been struggling with lower back pain, if you've been struggling with sciatica, if you've been struggling with herniated, if you've tried physio and it hasn't worked, right, like we said at the start of the session, and you want something that's a more robust, structured approach to help you going forwards, then check out the link on TikTok in the profile page. We'll post it in the comments on YouTube. You guys can check that out. Website, backinshapeprogram.com/join. There's a video there that explains and shows you guys a little bit more inside the actual program itself so you can see the way we lay things out. If you like it, you can join as well. So thanks to all of you guys that posted comments, posted questions. Sorry I didn't get to all of the ones that were over on TikTok. I think I got through all of the ones on YouTube. So thanks to all you guys there. And we will see you again tomorrow on the live. Take care, guys.